Sciatic pain can be brutal. Sharp, burning, or shooting pain down your leg. If you're tired of pain controlling your life, this video is for you. I've helped thousands of sciatica sufferers break free from the cycle of leg pain without surgery or medications. By the end of this video, you'll know the main causes of sciatica, how to stop making sciatic leg pain worse, and the steps you can take to finally get relief. First, we'll uncover the most common sciatic triggers. Then I'll show you the everyday mistakes keeping your pain alive. And stay until the end for 3 actionable steps to start easing sciatic pain today. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I've been helping patients overcome lower back pain, sciatica, and neck pain, all without medication, using specific chiropractic corrective techniques. If you're busy with work or home life and suffering from chronic spinal conditions, this channel is dedicated to helping you. Here you'll find exercises, expert tips, and proven strategies aimed at managing and preventing back and neck pain so you can stay active and pain-free. Before I dive in, subscribe to my channel if you want more tips and strategies to help you achieve a lasting relief, improve your mobility, and regain control of your life, all without relying on medications or surgery. Sciatica is a condition marked by pain radiating down the back of the thigh and leg, following the sciatic nerve. The sciatic nerve extends from the buttock region down each leg. In most cases, however, sciatic pain affects only one side of the body. Sciatica is intensely painful because it results from compression or irritation of one of 2 critical areas, either the sciatic nerve in the buttock region or the L4, 5, and S1 spinal nerve roots. These nerves are crucial for lower body movement and sensation, making the irritation or compression especially debilitating. The 4 most common causes of sciatica. Number 1, disc bulge or herniation in the lower lumbar spine. One of the most frequent causes of sciatica is a bulging or herniated disc in the lower back. These discs act as cushions between the vertebrae. When a disc bulges or ruptures, its soft center can push out and press against the nearby nerve roots, including L4, L5, or S1, that form the sciatic nerve. This compression leads to inflammation and sharp radiating leg pain commonly associated with sciatica. Number 2, spinal stenosis. Spinal stenosis is a narrowing of the spaces within the spine, which can compress the nerves traveling through the lower back and into the leg. This narrowing also often occurs due to age-related changes like bone spurs or thickened ligaments. When stenosis affects the lumbar spine, it can pinch the nerve roots following the sciatic nerve, resulting in pain, numbness, tingling that worsens with walking or prolonged sitting. Number 3, degenerative disc disease. Degenerative disc disease happens when the spinal discs lose hydration and flexibility over time, often due to wear and tear. This can lead to narrowing of the openings where the nerves exit the spine. If the L4, 5, or S1 nerves become compressed in these narrowed spaces, it can trigger sciatic symptoms. While this condition develops gradually, the resulting nerve irritation can lead to chronic discomfort and limited mobility. Number 4, Piriformis Syndrome. The piriformis muscle, located deep in the buttock, plays a crucial role in hip mobility. However, if this muscle becomes tight or spasms, it can directly compress or irritate the sciatic nerve as it passes through the buttock. This condition, known as Piriformis Syndrome, often causes severe leg pain and is less common but still a significant source of sciatica. Activities like prolonged sitting or intense physical activity can aggravate this muscle, worsening your symptoms. Understanding these causes is key to addressing the root problem and finding lasting relief from sciatic pain. Each cause of sciatica requires a specific, targeted treatment approach to effectively address the underlying issue and provide relief. While chiropractic adjustments to the lower lumbar spine and pelvis can help improve alignment and reduce nerve irritation for any of these causes, any accompanying exercises must be tailored to the specific problem to maximize results. Here's how treatment varies by cause. Number 1, disc bulge or herniation. Exercises should focus on relieving pressure on the affected disc and nerve root. For example, extension-based exercises like McKenzie press-ups are often used to encourage the disc material to move away from the nerve root, reducing pain and inflammation. Number 2, spinal stenosis. Stenosis responds well to flexion-based exercises that open up the spinal canal and create more space for the nerves. Examples include child pose and seated forward bends. Both of these exercises can help alleviate nerve compression by gently stretching and decompressing the lower spine. Number 3, degenerative disc disease. Examples should focus on improving core stability and spinal support to reduce pressure in the compressed nerve roots. Examples include core strengthening movements like planks or pelvic tilts. These help stabilize the lumbar spine and reduce excessive movement that might worsen the compression. Number 4, Piriformis Syndrome. Stretching and relaxing the piriformis muscle is critical to relieving compression on the sciatic nerve in the buttock. The piriformis stretch, like the seated figure 4 stretch, helps release tightness and reduce nerve irritation. Customize exercises for recovery. By tailoring exercises to the specific cause of sciatica, you can truly target the root cause of your pain while avoiding movements that might aggravate the condition. Combining these targeted exercises with chiropractic care ensures a holistic approach to restoring function and achieving long-lasting relief. I've covered these specific exercise approaches in other videos and will continue to dive deeper into each of these conditions in upcoming content. Make sure to subscribe and stay tuned for targeted guidance you need to overcome sciatic pain. Before I show you 3 actionable steps you can take today to start easing your sciatic pain, let me first point out everyday mistakes that might be making your sciatic pain worse and even stopping it from fully healing. Correcting these could be the game changer that you've been looking for. Number 1, prolonged sitting. Sitting for extended periods, especially on a soft or uneven surface, puts pressure on the lower back and compresses the sciatic nerve, aggravating pain. Poor posture while sitting, like slouching or leaning forward, can also strain the lower back and piriformis muscle. Instead, take frequent breaks to stand, walk, or stretch. Use an ergonomic chair that supports your lower back curve and keeps your hips slightly higher than your knees. Number 2, standing all day without breaks. Standing for long periods without shifting your weight or taking breaks can strain the lower back and aggravate the sciatic nerve. This is especially true if your posture isn't aligned or you stand on a hard surface. Instead, use a small step stool or similar object to place one foot on and alternate feet throughout the day. This helps reduce pressure on the sciatic nerve and provides relief for lower back. Number 3, sleeping in the wrong position. Sleeping on your stomach or without proper support can twist your spine, increasing pressure on the sciatic nerve and causing discomfort when you wake up in the mornings. Instead, sleep on your back with a pillow underneath your knees to keep your spine aligned, or sleep on your side with a pillow between your knees to help reduce lower back strain. Okay, so let's start with 3 action steps you can do right now to start getting rid of sciatic pain. Number 1 is going to be the sciatic nerve flossing. So what you want to do is you want to sit in a chair with good posture, and we're going to take our leg where we're having sciatic pain, and we're going to slowly lift it up until it's straight, and then we're going to bring our foot towards us. So we're going to flex the foot and bend the neck and hold, and then we're going to repeat the same thing. So bring the foot towards us and bring your neck down and repeat. We're going to do this 10 to 15 reps and coming back. And the goal of this is we want to help get that sciatic nerve gliding through the muscles to help relieve the irritation. So action step number 1 is going to be sciatic nerve flossing. Action step number 2 is going to be the knee to chest stretch. So this is a great way to relax the muscles in the lower back, help take pressure off the lower back, and help relieve sciatica. So you're going to lay on your back, either on the floor with a yoga mat or on a bed, and we're going to pull our knee towards the same shoulder, and we're going to hold for 20 to 30 seconds. We're going to pull nice and slow. We don't do anything fast, and hold. On the opposite leg, you can either keep it straight or you can keep it bent. And after 20 seconds, we're going to come back, and then we're going to repeat it for 3 to 5 sets. Once we've repeated that, you could either do the opposite leg, or you can pull both knees to your chest. But again, this is a great way to relax the muscles of the lower back to help relieve sciatic pain. Number 3, chiropractic adjustments to the lumbar spine and pelvis. Chiropractic adjustments help realign the spine, improving nerve function and reducing pressure on the sciatic nerve. Targeting the lower lumbar spine, L4 and L5, as well as the sacrum and pelvis can alleviate tension and irritation to the nerve roots, providing significant pain relief. Look for a chiropractor in your area who specializes in sciatic treatment and has extensive experience in addressing leg pain. A skilled chiropractor will tailor their adjustments to your specific cause of sciatica for optimal results. You know now what can cause sciatica, what could be making it worse, and the steps you can take to finally get rid of it for good. Remember, sciatica doesn't have to control your life. With the right knowledge and consistent action, you can find relief and get back to doing the things you love. Healing takes time, but every small step brings you closer to being pain-free. Don't give up. There's hope, and you're not alone on this journey. If you found value in this video, be sure to like and share it with someone who might need this information. And leave a comment below. I'd love to hear your sciatic story. What have you found that's working and giving you relief? Share your tips in the comments below so others in the community can learn and benefit as well. And don't forget to subscribe to my channel for more tips and strategies to achieve lasting relief, improve your mobility, and regain control of your life, all without relying on medications or surgery. The next video you should watch is this one, 4 easy sciatica relieving stretches. It's a full demonstration of simple exercises you can do at home to start easing your leg pain right away. Don't wait. Click now to take the next step toward recovery.